The first thing you will do in hand washing is to inspect surfaces of hands for breaks or cuts in skin or cuticles. Inspect hands for heavy soiling or dirt. Also inspect your nails individually for length. Take off any jewelries, especially wristwatch or rings, during washing. Stand in front of the sink, keeping hands and uniform away from the sink surface. Turn on water to regulate water flow and temperature. Avoid splashing water onto uniform. Wet hands and wrist thoroughly. Apply a small amount of soap and lather it thoroughly. Wash hands using plenty of lather and friction for at least 10 to 15 seconds. Interlace fingers and rub palms and back of hands in circular motion for at least 5 times each, while keeping fingertips down. Areas underlying fingernails are often soiled. Clean off both hands with additional soap if necessary. Wash your hands while fingers inserted. Rotational rubbing backwards and forwards. And rotational rubbing of left thumb in right palm and right thumb in left palm. Rinse hands and wrist thoroughly while keeping your hands down and elbows up. Using a paper towel, dry hands thoroughly from fingers to wrist and forearms. Turn off the hand faucet using the paper towel. Avoid touching handles with hands. And discard the paper towel. After hand washing, inspect surfaces of hands for obvious signs of soil or other contaminations. Also inspect for dermatitis or cracked skin. The first thing to do in open gloving is to prepare the sterile gloves, ensuring the correct size, and inspect for tear and or stains. Remove outer wrapper of the glove package by carefully separating and peeling apart sides. After removing the outer wrapper of the glove package, place the inner packaging on the sterile surface without touching them. Then, identify right and left glove. After identifying, pick up the dominant glove using your non-dominant hand. With thumb and first 2 fingers of non-dominant hand, grasp edge of cuff of glove for dominant hand. Touch only inside surface of glove. With glove dominant hand, slip fingers underneath cuff of second glove. And carefully pull second glove over non-dominant hand. Do not allow fingers and thumb of glove dominant hand to touch any part of exposed dominant hand. Keep thumb of dominant hand abducted back. After second glove is on, interlock fingers of gloved hands and hold away from body above waist level until beginning procedure. To remove sterile gloves, grab the palm of the dominant glove, pull the glove off, inside out into the non-dominant glove hand, and run the finger of the non-gloved hand underneath the cuff and pull the glove off the dominant hand inside out. Discard in appropriate receptacle and perform hand hygiene.